How do I get a medical cannabis card in Mississippi? That's what we'll discuss today on MCPA TV. I'm Angie Calhoun with the Mississippi Cannabis Patients Alliance, and today I have a really special guest with me, Kris Jones from the Department of Health. Thank you so much, Kris, for joining me today.
Thank you, Angie. I appreciate the invitation.
You're so welcome. Kris, tell us a little bit about what you do at the Department of Health.
So I am responsible for developing the medical cannabis program in the state, and it was a responsibility that was a little bit unanticipated, quite honestly. But my entire background in state government has been centered around mostly behavioral health and child welfare. And one of the things that was always really important to me was making programs accessible for people. And so that's really how we met, even Angie, is I started to look at this and I wanted to make sure that anything we put together was going to be accessible for the patients that need the program. So that's something we always try to keep in the forefront. So it was unanticipated, but has really been a gift for me.
Well, and I will say that it's a gift to the patients of Mississippi that we have Kris, because after working with her for several months now, I've just come to realize what an incredible person you are and how much she truly cares about this program, and that patients do have ease of access and that we have affordable products. And so we're going to jump on into some questions that we have been dying to hear.
Okay.
So Kris, tell us a little bit about how a patient gets a Mississippi medical cannabis card.
Okay. And that's a question we've been getting a lot, Angie. A lot of patients are reaching out and they think, oh, I can't stop by an office, I fill out a paper form, and I'm going to get a card. And that's not quite it. We wanted to make it a little bit easier than that even. I always tell people, if you can shop on Amazon, you'll be able to work this process. And we know we can shop on Amazon.
Yeah.
But a patient first has to see a practitioner. And for us, that's going to be a physician, a nurse practitioner, or an optometrist. And they have to have a relationship with that practitioner, because what they're looking for in that process is the practitioner's doing an assessment and making sure that they have a relationship with that person, because what they're trying to do is assess whether or not they have one of those debilitating conditions that's included in our law here in Mississippi. So they first see their practitioner, and an important point is that the practitioner has to be registered with us to participate in the program. So anytime a patient reaches out to me, that's my first response back is, you need to talk to your practitioner and you need to make sure that they know that you want to participate in the program, and you need to find out if they are participating in the program. So that happens really on the front end. There's that relationship. There's the conversation back and forth between the patient and the practitioner. And then the practitioner, once they're registered with us, they actually go into our online system and complete the written certification for the person.
Okay. Let me ask you this. This is a big question that people have. Will a patient have to establish the relationship, the bona fide relationship with the practitioner before their initial visit, or can it all be done at one time?
You know, some of that is left up to the practitioner.
Okay.
But, you know, I always suggest to patients that they go ahead and they start the conversation now, and they start to look for that practitioner that's going to be a good fit for them. So they can have that easy conversation and make their wishes known to the practitioner. Some people have asked, is there a specific time frame that relationship has to have been established in? And we have not put anything in place that indicates that.
Okay.
So really the practitioner has the opportunity. They may even review medical records of someone else and decide, okay, this patient has made their wishes known to me. I'm confirming their debilitating condition. I believe they would benefit from the use of medical cannabis. And that practitioner can go forward in completing that certification for that patient.
Okay. So the rumor that it's mandatory to see the practitioner ahead of time and then a mandatory second visit, that's not exactly true. It's up to the practitioner to decide if he or she can certify that patient in one visit. And
That's right.
What could our patients be doing right now to prepare for seeing those certified practitioners?
So just like I said, like I always suggest to people, go ahead and have the conversation with your practitioner, because when you look at the conditions that are included, our patients are already seeing a practitioner most of the time for whatever the condition may be. So there is usually an ongoing relationship and there's ongoing treatment there. So they really need to have those conversations now and make their wishes known, because I had a conversation even with a practitioner from another state. And one of the things she said to me was, at the time I didn't really consider it as an option. But the more my patients talked to me and the more interest they expressed, I started to change my mind about things and I started to look into it as an option. So really speaking up, advocating for themselves, making their wishes known, those are really important things they can do now.
Yeah. What about, should they go ahead and start getting their medical records together from the other physicians that they are seeing or practitioners so that they can present their case when they do that in-person visit with the practitioners?
Absolutely. Anything like that is going to be helpful.
Oh, I would think so. That way they can prove their debilitating medical condition.
That's right.
That would be great.
They may even be in a situation where they see a practitioner. Maybe that person is retired and they're looking for a new practitioner. So anytime they can have those medical records themselves, that's going to help also. Then you're not waiting on records to transfer and that type of thing.
Yeah. Well, Kris, another burning question is, how soon can a patient potentially get their medical cannabis card in Mississippi?
So that is a huge question that we get. This last month of May, and I say last month because we've had a time frame with the legislature after the act passed. We had, as an agency, 120 days to put regulations in place. And that is very quick in state government.
Indeed.
So we are finalizing regulations this month. So there'll be a lot of activity around that with the intent of taking applications starting June.
Wow.
Right.
That is amazing. So now if the practitioner has to be credentialed, are they able to go ahead and do that so that as of the 1st of June, the patient could start visiting their practitioner?
So the practitioner can't register until June either. But what we went ahead and did is we put out a frequently asked questions document for our practitioners, because one of the requirements that they have is that they have 8 hours of continuing medical education in order to apply. So we several weeks ago identified coursework that we would approve as part of the application process and put that out on our website so they could start to complete that training now. So the practitioners are ready to go June 1, so there's not as much of a delay for our patients.
That's wonderful to know, and I know that our patients will greatly appreciate that. So as of June 1, the patients can actually start seeing their practitioners and then fill out their application online, right?
That's right, online.
Only online.
Only online. And what happens is the practitioner completes that certification for them, and it kind of sits in a holding pattern in our system until the patient comes online and applies. And then we automatically match things with some indicators we marked in that application so that we know if I'm the practitioner and you come in and apply, it'll match and pull your certification. So it's nothing, no paperwork or anything that the patient has to keep up with.
Oh, that's great. That's wonderful. So how long will the application process take once the patient applies? Is there a time frame?
There is a time frame. And one of the things that's very important is that when a patient completes an application, even when a practitioner or anyone who may even apply as a dispensary or anything like that, that everything is complete when it gets to us. Because that just cuts down on that back and forth and sending documentation back and forth.
Absolutely.
So our goal is to have things complete in no more than 30 days for our facilities, but looking at about 5 to 10 for our patients.
Oh, wow. That is a very quick turnaround.
It is a very quick turnaround.
That's really exciting. I am really thrilled to hear that, Kris. And
yes.
Y'all have got so much to do these last 30 days or really less than that now, about 3 weeks actually. And so y'all are so busy, and to know that you're going to get that turned around in 5 to 10 days, that's just amazing.
Well, our goal is that once we have the information, everything is there, we have the certification, we have the application, that it's a quick turnaround. We don't want to hold things up.
Oh, that's great to hear. I'm so appreciative myself of that. And so, okay. And so what about the 6-month follow-up language that's in the bill? Tell us a little about that.
There is that 6-month follow-up language, and really when you look at it, once that practitioner issues the certification, it technically is good for a year. But I think what's important in that is our legislature, our policymakers had the foresight to think ahead and to think about that there needs to be follow-up with that practitioner. So if there are adjustments that need to be made, if there are possible interactions, that 6-month follow-up is a real important piece that the patient needs to remember. Oh wait, I've got to follow up with my practitioner, talk about anything that may be affecting them in terms of side effects they may experience or improvements that they're experiencing. So that 6-month follow-up is very important. Also for the ongoing certification.
So Kris, tell us about telehealth. Will that be an option for the patients this year?
You know, right now it's not going to be an option in this first year, but that's not to say, Angie, that as we get into the program and we learn many lessons, I'm sure that that's something that we can adjust going forward. I know that right now our legislature already has a list of things that they want to change and improvements they want to make, and I'm sure we'll do the same. So the first year it's not going to be available, but that doesn't say that doesn't mean that will be the case ongoing.
Yeah. Well, thanks for answering that. That's been something that a lot of people have been wondering about. And
yes, we get that question a lot.
I bet. And so now, will a patient have to reapply each year through the Department of Health for their card?
They will, and that's something that we've planned for on the front end. We want that renewal to be as simple as possible. It will be online again, and just basically updating their information or reporting any changes to it. So we want to keep that process very simple for them.
Thanks for tuning in to MCPA TV. We'll have another episode with Kris Jones from the Mississippi State Department of Health soon, so be sure to tune in then. And thank you, our viewers, for tuning in and watching MCPA TV. For more information, go to our website, follow us on social media, and share this video with your friends and family. Thank you again for tuning in to MCPA TV.